Assalamu alaikum warahmatullahi wabarakatuh. Our physiological lab this week is hematocrit determination. Hematocrit, or also called as packed cell volume (BCV) test, is part of the complete blood count test (CBC). Hematocrit is the measurement of the ratio of the volume occupied by red blood cells to the volume of whole blood in the sample of either capillary or venous blood. Determines the percentage of red blood cells in the whole blood, and this ratio also expressed either as a percentage or decimal fraction, for example 41% or 0.41. Clinically, the hematocrit is used to detect either the presence of anemia, polycythemia, hemodilution, or hemoconcentration, and other red cell volume alterations conditions. It's also used to calculate the mean corpuscular volume or mean cell volume, MCV, in conjugation with RBC's count. MCV is a measure of the size of the average of RBC's volume. MCV is calculated that the hematocrit is divided by the concentration of RBCs or RBC's counts. BCV is also used to calculate the mean corpuscular hemoglobin concentration in conjugation with hemoglobin concentration, MCHC, which is a measure of the concentration of hemoglobin in a given volume of packed red blood cells. It's calculated by dividing the hemoglobin by the hematocrit. The agent and equipment used in this test are capillary tubes 75 mm long, either blue banded tube with a blue tip, which means that this tube contains no anticoagulant agent and should be used with EDTA anticoagulated blood or blood treated with anticoagulated agent, or red banded tubes, red tips, which are heparinized tubes used for capillary blood or finger stick. Also use a clay type tube sealant, microhematocrit centrifuge, microhematocrit reader, cotton, and lancet. The hematocrit is usually determined by spinning a blood-filled capillary tube in a centrifuge. Specimen use either a venous blood anticoagulated with EDTA or capillary blood collected directly into heparinized capillary tubes with red tips. Specimen should be centrifuged within 6 hours after collection. If hemolysis occurs, another sample should be used. Methods for BCV determination: either span microhematocrit method or automated hematocrit method. Span microhematocrit method can be determined by centrifuging heparinized blood in capillary tube, also known as microhematocrit tube, at 10,000 rounds per minute for about 5 minutes. This will separate the blood sample into different layers, as we see later. The volume of packed red blood cells divided by the total volume of the blood sample gives the BCV value. Since here we use a tube, capillary tube, then we calculate it by measuring the length of the layers instead of their volumes. In automated hematocrit method, as we use a modern lab equipment, the hematocrit is directly measured by automated analyzer, and it's determined by multiplying the red cell count by the mean cell volume. It means that the BCV equal RBC counts multiplying by MCV. The result of the automated analyzer may be slightly more accurate than the direct measurement of BCV, as in the direct measurement method we may include a small amount of blood, a plasma, trapped between the red blood cells layer. The procedure of span microhematocrit method as follows. First, we puncture the skin of the finger and collect the blood from capillary directly into heparinized microhematocrit tube. Fill about 3/4 of their length. Seal one of the tube end with a clay or a sealant, and avoid trapping of air between the blood and the plug. Place the tube in calibrated microhematocrit centrifuge. The sealed end will be out against the rubber ring. Close the cover and set the timer for about 5 minutes and centrifuge at a speed of 10,000 to 15,000 rounds per minute. After that, the tube should be removed and read within a minute or two after centrifuging has been stopped to avoid the redispersion of the cells. Hemolysis, if occurs, should be noted, since this may lower the hematocrit result in relation to the hemoglobin. That the hematocrit, as we know, is 3 times the value of hemoglobin if the cells are normocytic with normal size and normal shape. Then we use a lined card to determine the hematocrit value by measuring the height of the total blood column and the height of red blood cell layer. As shown in this figure, after centrifuging, the capillary tube will be the blood sample divided in different layers, the red blood cells packed layer and the buffy coat which contain the white blood cells antibladed and the plasma layer. This figure of the microhematocrit reader. This also another figure of the reader card. Here we put the tube, and by making this line up at the end of the RBC's packed cell layer, we determine the BCV value. If we don't have the reader card, we can use simply a ruler by dividing the RBC's layer length by the total blood sample length. The normal references range for newborn 53 to 65%, for infant and child 30 to 43%, for men 42 to 55%, and for women 37 to 47%. Some causes of low hematocrit may include excessive destruction of red blood cells, for example as in hemolytic anemia, or decreased production of hemoglobin as in thalassemia, or acute or chronic bleeding from digestive tracts as in case of ulcers, nutritional deficiencies such as iron, folate, B12 deficiency, or damage to the bone marrow from, for example, toxin, radiation, chemotherapy, infection, or drugs, or kidney failure. As a result, there is no secretion of the erythropoietin hormone that stimulates RBC's production. Some causes of high hematocrit may include dehydration. This is the most common cause of high hematocrit value, or polycythemia, or kidney tumor that produce excess of erythropoietin hormone, smoking, or living at high altitude. This is an example of hematocrit measurement, which is the ratio, as we say, of packed cells to total volume. So if we have the length of packed red blood cells of 20 millimeter and the whole blood column length is 50 millimeter, then the hematocrit value will be 20 dividing by 50.4 multiplying by 100%, so it's equal to 40%. Source of errors in this procedure may be of improper sealing of the capillary tube causes decreased hematocrit reading as a result of loss of blood during centrifuging of the capillary tube, and higher number of erythrocytes are lost in relation to the plasma. Increased amount of anticoagulant used may decrease the hematocrit reading as a result of erythrocyte shrinking. Decreased or increased result may occur if the specimen was not properly mixed. The buffy coat of the specimen should not be included in the hematocrit reading because its inclusion falsely elevates the result of hematocrit value. Also, a decrease or increase in the reading may be seen if the microhematocrit reader is not used properly, if the centrifugation too short or the speed is too low. An increase in the trapped plasma may occur in a range of 1 to 3% will occur in normal blood. Low hematocrit reading may result immediately after blood loss because the plasma is replaced faster than erythrocytes by the body. The proper specimen collection is important consideration as the introduction of interstitial fluid from the skin puncture causes decrease in the hematocrit reading. increased amount of trapped plasma in red cell column can produce error in patients with an erythrocyte abnormality such as sickle cell anemia. Okay, this is a question. Do allow the tubes to remain in the centrifuge for more than 10 minutes after the end of centrifugation. This can't do it because the red cells here can begin to settle out and cause a false reading of the hematocrit. A number of disorders such as sickle cell anemia, macrocytic anemia, and thalassemia may cause plasma to be trapped in the erythrocyte, even if the procedure was performed properly. The hematocrit centrifuge should never be forced to stop by applying pressure to the metal cover plate, since this will cause the RBC's layer to sling forward and results in falsely elevated values of the BCV. The rule of 3. As we say, the hematocrit is approximately 3 times the hemoglobin value when RBCs are normal in size and contain normal amount of hemoglobin. By comparing the hemoglobin with hematocrit results in percentage unit using the following formula, hematocrit plus minus 3 unit is equal to the hemoglobin multiplying by 3. For example, the following result obtained from patient, hemoglobin was equal to 12 gram per deciliter, so we thought that hematocrit might be 12 multiplying by 3, 36.36 or 0.33 to 0.39 as a range, according to the rule of 3. Thank you for listening and good luck.